If your erections are not as strong as they once were, if your energy seems to disappear halfway through the day, and if you find yourself avoiding intimacy because your body is no longer responding the way it used to, then listen carefully. What you are experiencing may not simply be aging. In many cases, it may be your body's way of signaling a deficiency in a few key nutrients that become increasingly important after the age of 60. I'm Dr. Sofia, and for years I have worked with older men who believed their vitality was gone forever, only to discover that the real issue was often much simpler than they imagined. Many men assume that declining energy, poor circulation, and reduced performance are unavoidable parts of getting older. But what most people never hear is that your body still has an incredible ability to support strength, stamina, and confidence when it receives the nutrients it needs. Today, I want to share 3 vitamins that every man over 60 should pay close attention to because they play a major role in circulation, energy production, and hormonal health. The first is vitamin D. Most people know it as the sunshine vitamin, but its benefits go far beyond bone health. As we age, our bodies become less efficient at producing and using vitamin D. Unfortunately, this deficiency can affect circulation, energy levels, and overall vitality. Vitamin D helps support the production of nitric oxide, a molecule that allows blood vessels to relax and expand. Healthy blood flow is essential not only for heart health but also for physical performance and intimacy. I remember speaking with a patient who told me he still felt young in his mind, but noticed that his body no longer responded the way it once did. After testing revealed a vitamin D deficiency, he began making simple changes, including spending more time outdoors, improving his diet, and taking a quality vitamin D3 supplement. Within a few months, he noticed better energy, improved stamina, and a renewed sense of confidence. While vitamin D is not a miracle cure, it often serves as the foundation for better health in older men. Foods such as salmon, tuna, fortified dairy products, and egg yolks can help increase your vitamin D intake. Regular sunlight exposure also remains one of the most natural ways to support healthy levels. For many men over 60, however, supplementation may be necessary because the body's ability to produce vitamin D declines with age. The second vitamin is vitamin B12, often called the energy vitamin. If you constantly feel tired despite getting enough sleep, this nutrient may be especially important. Vitamin B12 helps your body convert food into usable energy. It also supports the production of red blood cells, which carry oxygen throughout your body. When oxygen delivery is compromised, fatigue, brain fog, weakness, and reduced physical performance often follow. One of my patients, a retired firefighter in his 70s, came to me complaining of constant exhaustion. He was sleeping well and eating reasonably healthy meals, yet he felt drained every day. After further evaluation, we discovered that his vitamin B12 levels were significantly lower than they should have been. Once he corrected the deficiency, he experienced remarkable improvements in his energy, focus, and motivation. The challenge is that as men age, their ability to absorb vitamin B12 from food decreases. Even if you're eating meat, eggs, or dairy products regularly, your body may not be absorbing enough of the vitamin. That's why many men over 60 unknowingly develop deficiencies that slowly rob them of their energy and enthusiasm for life. Quality supplementation can often make a significant difference. Some men may even require B12 injections if absorption becomes a serious issue. Restoring healthy B12 levels can help improve mental clarity, stamina, and overall quality of life. The third vitamin is vitamin E. While many people associate it with skin health, its role in men's health is far more significant. Vitamin E acts as a powerful antioxidant, helping protect blood vessels, tissues, and cells from damage caused by oxidative stress. As we age, inflammation and oxidative damage can negatively affect circulation, hormone production, and physical performance. One gentleman I worked with was frustrated because he exercised regularly and maintained a healthy lifestyle, yet he still felt like something was missing. He described lower motivation, reduced confidence, and a general decline in vitality. After improving his vitamin E intake through diet and supplementation, he noticed gradual improvements in his energy, mood, and overall well-being. Vitamin E helps maintain healthy blood vessels, which is important because strong circulation is critical for every organ in the body. It may also support healthy testosterone function, which becomes increasingly important as men age. Low testosterone levels can affect mood, motivation, energy, and intimacy. Good sources of vitamin E include almonds, sunflower seeds, spinach, olive oil, and other leafy green vegetables. These foods are easy to incorporate into a balanced diet and can provide meaningful support for long-term health. What makes these three vitamins particularly effective is how they work together. Vitamin D supports blood flow and circulation. Vitamin B12 helps generate energy and supports oxygen transport. Vitamin E protects blood vessels and helps maintain healthy hormone function. Together, they create a powerful combination that supports vitality from multiple angles. However, there is one mistake that many men make. They assume that all supplements are created equal. Unfortunately, that is not the case. Low-quality supplements often contain forms of vitamins that are poorly absorbed by the body. For example, when choosing vitamin B12, many experts recommend methylcobalamin because it is more readily utilized by the body. When selecting vitamin D, vitamin D3 is generally preferred over D2. Quality matters and consistency matters even more. Another common mistake is taking supplements only occasionally. Your body thrives on consistency. Taking vitamins once in a while is unlikely to produce meaningful results. Daily habits are what create long-term improvements in energy, circulation, and overall health. A simple routine can make a big difference. Start your morning with a nutritious breakfast and your vitamin B12 supplement. Spend 15 to 20 minutes outside whenever possible to support natural vitamin D production. Include foods rich in vitamin E, such as almonds, sunflower seeds, spinach, and olive oil throughout the day. These small actions may seem simple, but over time they can have a significant impact on how you feel. Before we finish, I want to remind you of something important. Growing older does not mean giving up on your health, your energy, or your confidence. Many men assume that decline is inevitable, but I have seen countless individuals make meaningful improvements simply by addressing nutritional deficiencies and adopting healthier daily habits. The truth is that your body still responds to the care you give it. Supporting circulation, energy production, and hormonal health is not about chasing youth. It is about helping your body function at its best so you can continue enjoying the things that matter most. Whether that means spending time with your family, staying active, maintaining independence, or feeling more confident in your relationships, those goals remain within reach. I'm Dr. Sofia, and I encourage you to start paying attention to these three essential vitamins today. Small changes practiced consistently can often produce results that feel surprisingly powerful. Your best days may not be behind you. In many cases, they may still be ahead of you. If you found this information helpful, leave a comment below and let me know which of these vitamins you plan to focus on first. Take care of yourself, stay healthy, and I'll see you in the next video.